Welcome to the Health Resource Media Network, also known as HRMN. The program was created to provide information on various forms of healthcare services. I'm Ursula Darby. Today we'll be spending time with Dr. Oronde White, the founder of the Lighthouse Medical Clinic located in Southfield, Michigan.
Curriculum vitae. Dr. Oronde White, MD, graduated magna cum laude with a Bachelor of Science in Biology with a pre-professional concentration. He attended Michigan State University College of Human Medicine, where he earned his medical degree. Dr. White's residency experience includes Detroit Medical Center, Sinai Grace Hospital. He was awarded the Biological Station Scholarship and the Academic Excellence Award from Central Michigan University. He's also a lifetime member of the Golden Key National Honor Society.
Dr. White, welcome to the program.
Thank you, Ursula. It's good to be here.
So tell us, what is your field of medicine?
Well, I'm an internal medicine doctor. In other words, that means general adult medical care.
Okay. And how long have you been practicing?
I've been practicing since 2000 totally, but in my present location I've been practicing about a year.
So let's talk about the Lighthouse Clinic. How did you come up with the name?
Well, to me the name Lighthouse represented what I wanted to do with my practice in the field of medicine. And basically, for people who have serious health problems, they feel totally isolated. It's a very terrible experience. You feel as if you're in a sea of darkness. And basically what I wanted to do was to hopefully be a source of light to people so that they can come from out of the darkness and into the light of good health.
Dr. White, that was such a heartfelt comment. I mean, it just hit me right here. I can tell that you really care about your patients, but how do you get people to the point where they care more about themselves and their health enough to change their lifestyle, to get on that, the road to good health?
The way that I go about it is that everyone deep down inside truly wants to enjoy life and be happy. And that's one of the keys. And what I do is I try to remind people of that, because it's already inside, deep within, even in people who are deathly ill. And that's the reason why they come to my office in the first place. So when they're there, I know that I have to reach out to them. I have to provide them some hope, in which there truly is hope, because so many people start to give up after years of suffering and not getting the type of help that they truly need.
We need to take a break, but we'll be right back after this.
Dr. White has proven himself to be very dependable. He takes his time and explains to the patients what is going on. Sometimes it may go over your head, but by the time he leaves out of that room, you understand thoroughly what he is explaining to you. It even gives you the information to take it and consider your choices of treatment. I admire Dr. White and what he's done for his patients, especially me, and I would recommend any patient to come to this office. He goes beyond the call of duty. He will tell you that he's there to help. And I know he's done things that sometimes attending physicians do not do. And I am a witness that if you do need a good doctor, this is the place to come. He treats you with respect, but at the same time, he treats you like a friend. And I'm glad that I looked in the yellow pages on that Saturday and found this practice, because I'm standing here as a result of it.
We're back with Dr. Oronde White from the Lighthouse Clinic in Southfield, Michigan. Let's talk about some of the conditions that you treat. What are the most common types of conditions that you are treating right now?
Well, most of the conditions that I'm treating now relate to high blood pressure and cardiovascular disease, obesity, diabetes, cancer, a wide range of health problems.
Doctor, most of the conditions that you named are primarily conditions that affect the African American community, meaning that most of them are hereditary. Are there anything, is there anything that people can do to try and prevent getting some of those conditions, even though it may be hereditary?
That's part of the reason why I take the approach to medicine that I take. And that is that it's very well founded that genetics and heredity play a huge role in health, wellness, and disease. But something that is often overlooked is learning, behavior, and habits. And this is something that is extremely difficult to tease out oftentimes, that all of this disease isn't necessarily due to genes. But poor eating habits are critical in the role of developing disease and in people's ability to stay healthy. For example, from the time that we're born, we all come into this world like a blank sheet of paper, and we know nothing. And who we learn from principally are parents. And we basically adopt all of their habits just by watching them. And that's the most powerful learning that all of us do. But if your parents have poor habits, then you will follow in their footsteps and develop a lot of the same health problems that they develop that isn't necessarily genetic, but it's an interaction between a person and their environment. It's about choices and decisions. It's about what you eat, how you live, and this is where I've been able to make a big difference in a lot of my patients' lives, is explaining to them how those types of choices make a huge difference in their health.
So learned behaviors, that has to be the hardest thing, reprogramming the way patients think. Have you found the secret to making that easy for some of your patients?
Basically, the answer to that question is, really, I don't try to change people's learning and behavior in the beginning. What I do is I realize that basically one of the hardest things to change is daily behavior and habits. So rather than try to change that, basically, which is to me like trying to get the average person to move a mountain, what I do is I bring to people something that anyone can do. And you don't have to be a genius, you don't have to be smart, you don't have to have what's frequently referred to as willpower or any of those things. Anybody who's sitting at home watching me and understanding what I'm saying has the ability to change their lives. And the way that I usually start by doing this is doing principles that anyone can do with no effort, no discipline, not becoming educated about health or science or nutrition, but can apply these principles to start getting some immediate benefits right away.
Stay tuned. We'll be back with more from Dr. Oronde White on the Lighthouse Clinic.
So I was looking for a doctor that was professional, as well as a staff that was professional as well. He has a professional staff. They get me in and they get me out. And with the busy schedule that everyone has, I know a lot of people are really just looking for that. Just someone that knows them and can give them the professional advice that they need for their health or for whatever medical need that they're dealing with at that time. And if that's what you're looking for, then Dr. White is definitely your guy.